Welcome back to Rohrich Knows Podcast. This is a rapid fire session, and I sometimes put my guests on the line with rapid fire questions. Now, they've never seen them before. I did this recently with Tony Jung, and he, of course, he's a rock star, just like David. David Weir is my nurse practitioner, and we're going to do rapid fire on cosmetic medicine. David, you ready?
I have no idea what I got myself into, so I hope so.
Okay. All right. So rapid fire. So I'm going to ask you, what's new and hot in toxins? Does it work or not? Just rapid fire. So prejuvenation, does it work? Is it hype?
No, I think it works to an extent. I think if you're doing
You're going to inject a 15-year-old with Botox?
No, gosh, no, not with Botox. I mean, my rule of thumb with any neuromodulator or Botox is if you can make it, if you animate and when you're done animating there are still lines there, then you're a good candidate for Botox.
Good.
This baby Botox, bunny Botox, actor tox, whatever they're calling it, I think it's kind of gimmicky. I think you should use Botox when you need it, but you don't necessarily need it before you don't need it.
Right, and I think this thing about, you can prevent lines and wrinkles, I don't know. I mean, you could probably weaken them early on if you start them in your 20s. So, okay, old fillers, new places.
So old fillers, new places. There's a lot of places we're putting filler nowadays. The only thing I worry about with old fillers and new places is that there's a rapid trend of mass amounts of filler being put in the human body. And there's some studies coming out of southern Florida where these people are coming from Puerto Rico or Mexico and they're having these procedures done where they're putting like 80 to 100 cc's of hyaluronic acid filler into like the buttocks or the arms to make you look buff. I mean, all these things. And some of these patients are coming back with these kind of autoimmune-like symptoms.
Yes.
Malaise, tiredness, fatigue, intermittent fevers. I mean, so is more of a good thing when it comes to filler? We don't know yet. We honestly don't know.
Right, and I think, if you're using well-known fillers, that are FDA approved, like Restylane and Juvederm and all these fillers, and putting them into new FDA approved places like the temporal areas and neuromodulators for the masseters, that's okay. But to do a lot of volume and multiple stacking is probably problematic. Okay, long-lasting Botox, yes or no?
I do my own, so yes.
Yes?
I don't like to stab myself in the face. So yeah, I think they work. I think there are longer lasting neuromodulators on the market. There's going to be 8 neuromodulators in the next 24 months.
I know, 4 this year, I think.
4 this year. So, I mean, the neuromodulator game is changing. Longer lasting results, less treatment visits, as long as the price is right, why not? And the thing, even with the longer lasting neuromodulator that we have now, I tell patients, like, this works for some people, and some people it works just like their normal neuromodulator, and we won't know until we try.
Right.
But I've had some great success with it. I think it's a wonderful product in the longer lasting market, and I'm seeing it longer lasting than Botox, and price-wise, we can make it the same cost as traditional neuromodulators in some cases. So, I mean, if you can make it last longer, why not?
Okay, I agree. I mean, and then, do HA fillers really totally resorb?
No.
No, that's an epiphany. And so they're not necessarily resorbable, especially if you pound it into faces too much.
I remember you were doing a lower bleph on somebody.
Yes.
I don't even, this is several years ago. And I typically don't like to touch somebody with HA filler within like a year of surgery, because you should go in as a clean slate as possible so the surgeon knows exactly what needs to be excised and where fat needs to go, et cetera. And I remember dissolving, you were doing a lower bleph and there was Restylane put in this lady's tear troughs from like 5 years prior.
Came out.
So yeah, it was like you couldn't see it, but when you retract the skin, you're like, oh wow, there's hyaluronic acid still there. So I think HA fillers are lasting a lot longer than we think they do, but we're also aging at the same time. So patients topographically think they're not lasting because there's so many other things that are changing in the face as you age.
Right, and less is more. Don't keep pounding fillers in the tear troughs and the lips, and you can't just melt them out. Okay, long-lasting sunscreens, and are sunscreens dangerous? Some sunscreens dangerous?
Yeah, so the big thing right now with sunscreens, there are new longer-lasting ones that I think are great, and the reason why is because the photo protection that we get from most sunscreens only lasts about 90 minutes, maybe 2 hours, and we're getting sun exposure indoors and outdoors, not just outdoors like we thought. And if you're not reapplying it every 90 minutes to 120 minutes, you're not using your sunscreen correctly. So longer lasting sunscreens, fantastic. There is a great move to more mineral-based sunscreens because there's physical sunscreens, mineral sunscreens, and then there's chemically derived sunscreens. And what some of the data showing is that some of these heavier, more chemically derived sunscreens are actually not safe. You can actually find low levels or even sometimes toxic levels of these ingredients in patients' bloodstream who's been using these chemical-based sunscreens. So I tend to stick to more mineral-based just to be safer.
Okay. Okay, so exosome therapy, hot topic.
Oh, hot topic indeed. So there are several exosome companies out there. I think everyone probably knows who my favorite is because they're doing a lot of research into it. Breon is my favorite, just because they have the data to prove it. A lot of the other exosome companies are focusing on how many exosomes they have, not what the exosomes are doing. So I think it's more important that we should be focusing on what they're doing versus how many are in there. And, you know, I said this to a group of my peers the other day. I said, if you know, because there's people injecting exosomes. Okay?
Right.
There's no FDA-approved injectable exosome. Okay?
Right.
Your malpractice won't cover it either. I checked. So
don't do it.
Don't do it. But I questioned them. I said, are you doing a skin exam before you inject these exosomes? And they're like, why? And I was like, well, if you have a suspicious skin lesion and you inject it with Miracle-Gro, why wouldn't you do a skin exam first? And you know, so
exactly.
we have a fantastic relationship with Dr. Cather, who's in our building. She's a dermatologist. I don't want to do any sort of med derm. So if on my skin exam, if I see something suspicious, I punt them to my patient to her because she's the expert in all things skin cancer. So I think exosomes are good, but they're in their infancy, and you got to go with a product that actually has data behind it and supports their claims.
Okay, let's go to kind of laser-based, from intense pulse light to not entirely, you know, laser in the Cyton group, the Moxie, the Halo, and then everything. So where does that fit in the armamentarium of skincare, and does it really rejuvenate the skin, enhance and long telomeres?
Yeah, so I mean, with the lasers and the IPLs devices out there, I recommend all my clients have a pretty aggressive laser once a year and then follow it with quarterly maintenance of something that's causing injury to the skin to keep the collagen working. So the actual creator of the BBL, if you look at this guy BBL launched like 20 years ago, it doesn't look like he's aged in 20 years. Now, I'm sure he gets a full body BBL every month. But
4 a year, I think.
Yeah, but you know, you do get neocollagenesis with it. So if you can limit the amount of sun damage and pull it out of the skin using these devices and create collagen and elastin at the same time, why not? Why not?
Yep. Radio frequency versus microneedling. Tell me, where do you put it in the armamentarium now?
Yeah, so radio frequency versus microneedling. If I have a younger person that has textural issues, acne, scarring, etc., I'm probably going to stick with traditional traditional microneedling. If I have a patient that has some skin laxity involved, then I'm going to probably do radio frequency. And it also depends on their downtime and you know, what they're hoping to achieve. Radio frequency treatments are much more expensive to do.
Right. So
that cost is offset to the patient. So sometimes it's budget concerns to what works for them. But typically my younger patients, I just say do microneedling, and my more mature patients, you know, 40 plus, the addition of the radio frequency has some additional benefits as far as skin tightening.
What about PRP? Where does that fit in the whole
Yeah, so
area?
PRP, I think PRP works beautifully when it's injected, okay? It also only works well in healthy patients. If you are a healthy person, morbidly obese, have 10 diagnoses, you're taking 10 different medications, your platelets are only going to be as healthy as you are. So injecting them isn't going to really do you much. But if you're young and healthy, or even mature and healthy, and have good blood flow, good platelet count, then I think you can get some really nice regenerative effects from injecting platelets. I do not believe. Well, I actually know, because we did a study on this that we couldn't publish, that topical application of PRP post-microneedling actually prolonged healing. Okay, and only altered the result less than 3%. So is it really worth the risk of drawing the blood and doing all that stuff to the patient? Topically, I don't believe it works.
So So when do you use it?
And just injected. Like if all my patients that I were doing topical PRP to, now I just, before they come in for their appointment, I say we have to inject it. If you want it to work, if you want to pay for it, I'm going to get your money's worth.
And I like it for the dark.
I love it under the eyes.
I love it, and I send you patients all the time because there's no good treatment and it works well.
Yeah, I mean, I avoid filler in the medial tear trough all the time. I think PRP, PRF is the way to go.
Okay. All right. We're going to end with these 10 best supplements. Now, these are things that I take. I take omega-3s. I take magnesium, vitamin D. I use probiotics, creatine when I'm exercising, and vitamin C, an antioxidant. And then I use coumarin, which is from the turmeric plant, and then coenzyme 10, collagen, and what do you think of that?
I think that's an excellent list of supplements. I think you need a really big pill case. If we could wrap all that up into one pill, I think it'd be great. But I think, the average consumer in the U.S., in my opinion, we don't eat the triangle of food that we're supposed to daily. So we're not getting the essential nutrients and minerals that we should be getting from our food on a daily basis. So I think supplementation is key here. And everything that you've listed here from fish oil, mag, D, I mean, these are all fantastic supplements that have been well studied. But you have to make sure that you're getting a supplement from a reputable company, just because the FDA doesn't regulate supplements. So if you're just going to GNC and randomly picking up some vitamin C on the counter, they're not all created equally.
Yep, I agree. So, know before you go. Any closing comments, David? What's hot, what's new in cosmetic medicine that we haven't covered?
I really think the next step is regenerative. Like there's a big wave of regenerative medicine. There's a lot of companies trying to get approved by the FDA currently, looking at how can we inject something to cause the body to stimulate this biostimulatory effect. So I think that's probably the next hot topic is regenerative medicine.
Right, and I think it's the natural way to go. Stimulate your body to do the right thing rather than fillers. So, leave me your thoughts and comments. Know before you go, and thanks again, David, for you did amazing on these rapid fire hot topics. Till next time.